So during last week's meeting, you had mentioned that there was a significant drop in number of cases of the flu relative to their impact on the ED and hospital beds required for the treatment of patients. So with that being said, are we going to need additional beds in our community like New York has put into place?
We don't know that, obviously. I will comment on the flu. What's been really interesting, I did comment last week that it literally has all but disappeared in Tulare County. And generally, historically, the flu has almost always carried into April. You know, it definitely starts subsiding as the weather warms and just the seasonal nature of it starts to die off. But generally, we're still getting a lot of positive cases in April and getting a lot of hospitalizations, but there are virtually none, which is going to be interesting how much we attribute that to the social distancing and people staying home and having, you know, less contact. That certainly seems to have had an effect on controlling the flu. So something for us to learn from and maybe incorporate into our lives this next flu season. But with respect to additional beds, so I tell folks it's really kind of eerie right now at the hospital. As I do round on the different units, I round in the emergency department, and it's eerily quiet. I can't remember the last time that the hospital has been as empty as it is right now. I think the census today in the medical center was about 230 patients. So we have 403 beds in our acute medical center, the downtown medical center. So roughly just a little over 50% occupancy. Normally, you know, during this time of the year, we're probably still running at 80% occupancy. So the actions that we took to curb elective surgeries, you know, screening, colonoscopies, just services that we really cut back, plus also just the community's anxiety about just coming to the hospital to begin with has really, I'll say, had a positive impact, you know, in terms of creating bed capacity right now. But we are fully anticipating that that could change very quickly. So I was on a call with all the hospital CEOs from Kern County to Merced just a couple days ago. There are a number of predictive analytical modeling tools that are out there right now that are trying to help communities, help states, help counties, help hospitals kind of gauge what they might be expecting to be able to ramp up to an imminent surge. And what we heard is that for California, obviously LA and the Bay Area are the most, have the most dense populations, and they are having some of the highest incident rate right now of the virus. We heard that it's likely that the first surge will hit the Bay Area, and they were talking Santa Clara, San Jose, San Mateo, San Francisco. They originally were predicting, using this model, that they would begin to see that surge this weekend, but they've now pushed that back to about mid-April. Then they also believe that the San Joaquin Valley is about a week or two behind the Bay Area, which would put our potential surge towards the end of April. So we're doing a lot of planning in anticipation of that. So let me kind of, I'll share a few things with you. So, and again, I apologize if I'm repeating myself. So one of our nursing units in the Mineral King Wing, we have 2 south, 2 north, 3 south, 3 north, 4 south, 4 north. Collectively, those 3 floors have 221 of the 403 beds that we have downtown. So 2 South has been converted into our dedicated COVID unit. So there are 29 beds that are on that unit. And so whenever we have a confirmed positive COVID case or a suspected COVID case or somebody that we're uncertain, they have a respiratory condition, that's where we admit them to that floor. So that will be the first dedicated COVID unit. Today, we are now converting an 11-bed unit in our east expansion that opened in the early 90s. So in that east wing, we have an 11-bed unit we call the Broderick Pavilion, named after Kathy Broderick, a longtime nurse here at Cahuilla Delta. So that unit has historically been what we call our kind of healthy, short-stay surgical unit. So an otherwise healthy person comes in, has shoulder surgery or knee surgery. They generally go into that Broderick Pavilion, averages about a 2 to 3 day stay. So that unit has been completely cleared, which, as you might expect, because we've limited so much elective surgery, they haven't had many patients to begin with. But that unit right now today is being converted into a dedicated COVID unit. And then the emergency department, there's a 9-bed expansion that has been going on for some period of time. It's called what we call Zone 4. It's on the northern end of the emergency department. We had intended that that was going to be a place where we cohorted patients that presented to the ED with mental health issues that also might have medical issues at the same time. We're going to not move forward with that right now and convert Zone 4 to a COVID rule out area for the emergency department. Then the 5th and 6th floors of the Acequia wing, we've been working on those for well over a year. The 5th floor was going to be a 24-bed intermediate critical care unit. The 6th floor was going to be a 23-bed NICU. So under normal circumstances, those units probably wouldn't be completed and ready for occupancy for a couple months. We got the green light from the Office of Statewide Health Planning and Development, or OSHPD, and the California Department of Public Health to greatly accelerate opening those units. So they actually might be ready for occupancy as early as tomorrow. We just have to finish some air balancing work with the engineers and construction crew, but probably will be ready to start accepting patients next week. So immediately 5 Tower, that 24-bed ICCU, will be another unit available to take COVID patients. The 6th floor, the plan is to take the 15-bed existing NICU that we have that's in the East Tower. We will move those NICU patients up to the 6th floor. That will then clear out the 2nd floor in the center of the East expansion, and that will probably be able to house 9 adult patients. So that could also be another dedicated COVID unit. Depending on how this surge evolves and how intense it becomes, it is possible that, one additional thing, so we also have a 12-bed pediatric unit. And the next stage, again, depending how it evolves, is we'd move any pediatric patients that are on that 12-bed unit, we would move them into the mother-baby unit in the Acequia wing. That would then free up those 12 beds on the peds unit that, again, could become adult beds, and they could be for COVID patients. Again, depending on the intensity of it, I've already spoken to the CEO of Valley Children's Hospital, Todd Suntrapak. I talked to him last week, and they are prepared if necessary. This would be really one of the last things that we'd want to do. But if we found ourselves needing that 6th floor NICU, then for adult COVID patients, we would then transfer those neonatal patients to Valley Children's and convert the 6th floor to an adult COVID unit. We also have our 45-bed acute rehab unit out on our West Campus. It's currently running a census of about 20 patients. The federal government has already completely suspended literally all regulations that would, in normal circumstances, we could not admit patients to acute rehab unless they met specific rehab criteria. Those rules have been suspended, so we could now turn any of those empty beds into just adult medical surgical beds, COVID patients. Same with our 63-bed mental health facility on that West Campus. It has beds that could be converted as well. So, and then also, again, just thinking worst case, Randy Groom, our city manager, and I spoke probably a couple weeks ago about potentially, converting the convention center, other city-owned properties into temporary patient units. I want to thank Randy and the city council, and it's been great working with the city. They've been very, very proactive, reaching out to us, making certain that they can provide us any support we need. So that's kind of, our immediate bed capacity and what it could look like. And obviously it would operate on a continuum depending on responding as the surge intensified. But a lot of plans in place. The greatest concern, though, is you could have all these beds, but you don't have the staff.
Right,
You don't have
right.
the physicians, and that is the concern of most hospitals across the country. We are reaching out to retired nurses, retired physicians, nurses that work per diem, maybe only a couple shifts a month for us, about potentially ramping up. We have been contacted by a number of folks that are interested in coming out of retirement, and bless them for that. The governor earlier this week issued an executive order that would allow hospitals to use nursing students that might be towards the very end of their training in nursing school, but they haven't graduated yet. If there was a way to use them in the hospital, we probably wouldn't use them as RNs, but they might be able to function as a certified nursing assistant or be part of the team. Also looking at our residents that are still in training, but could step in and provide medical care as well. Right. And medical students. On any given day, we have medical students from USC and other schools, seeing how they might be put into play as well.